All right, so now we have done abdominal arterial flow and venous drainage. And now we're basically coming to the end of the descending abdominal aorta. And we're going to split at the end into the left and right common iliac arteries, which are going to collectively give the blood supply to the pelvis and the legs, the thighs, the legs, and the feet. Okay. So what that's going to look like if you follow it down here, here's the right common iliac artery. It is what happens at the end of the descending abdominal aorta. So then it's going to split, and it's going to split into the internal iliac artery. And the internal iliac artery, to oversimplify, kind of gives blood supply to your pelvic cavity, your junk, your urinary bladder, the uterus, the vagina, the vas deferens. That's all coming from the internal iliac artery. And then the external iliac artery supplies the lower extremities, but also the external genitalia, like the penis and the clitoris. So the external iliac artery is this big guy right here. It will pass under the inguinal ligament, and then it's going to be kind of what you would expect for most of the vessels. It's going to go through the thigh, and it's going to be the femoral artery as it goes through the thigh. And then as it goes behind the knee, here, this is a posterior view. It's the popliteal artery, not surprisingly. And then the popliteal artery, the femoral artery is going to basically supply most of the thigh as it goes by. The popliteal artery is going to supply the knee. And then the posterior tibial artery will do basically most of the back of the leg. Here's your posterior tibial. Okay. And the posterior compartment of the leg, also, if you follow it down, it will go to the plantar surface of the foot. And then the posterior tibial will give rise to the peroneal artery, which supplies the lateral. They've changed the name to the fibular. The fibular artery, which will supply the lateral compartment. And then also it gives rise to the anterior tibial artery, which is this guy. Supplies the anterior portion of the leg and the dorsum of the foot. And then this one's going to form an arch. This one's going to form an arch. They'll give rise to the digitals. Okay, so let's do this one more time. All right, so common iliac splits into internal iliac, takes care of most of your junk. External iliac, which gives rise to the femoral, gives rise to the peroneal, okay? Then the peroneal will continue down the back of the leg as the posterior tibial. That will form some arches and then digital arteries, okay? It will also give rise to the fibular artery, which goes lateral, not surprisingly. And then the anterior tibial artery, which goes anterior. That will give rise to some arches and some digitals, okay? And that's basically the arterial supply to the lower limb. And then the venous drainage of the lower limb is kind of similar, but again, superficial drainage as well. It's not hard though. So let's do the venous drainage of the pelvis and the lower limb. Venous drainage of pelvis and lower limb. Okay, so how do we get the blood back and where does it end up? Well, where it ends up, I'll show you this real quick, is they are going to gather up and then end up in common iliac veins, which will join to form the inferior vena cava. So we'll come back to that in just a second, but that's where we're headed. We're going to head into the left and right common iliac veins, and then the internal iliac veins, external iliac veins will join to form the common iliac veins. Okay, so let's do the deep drainage. Okay, so deep drainage goes like this. Anterior compartment is drained by these guys. Oops. which are the anterior tibial veins, and those run anterior to the tibia. And then the posterior compartment is drained by these guys, which is the posterior tibial veins, and those run posterior. Those two will gather up together into the popliteal vein, okay? Then the popliteal vein, and by the way, we're doing deep drainage right now. Popliteal vein will continue up as the femoral, okay? The femoral will go under the inguinal ligament. Then you will gather in the internal iliac, and then it will become the common iliac. And then let's do the superficial drainage. And again, the superficial drainage is in the lighter color. You really only have to know 2 superficial vessels, and they are the longest vessel in the body, which is this big honker that starts on the medial surface and goes all the way up the medial portion of the thigh. That is the great saphenous vein. Some textbooks call it the greater saphenous vein. And that one usually dumps into the femoral vein. And then the small saphenous vein runs behind the lateral malleolus at the back of the leg, and then it dumps into, let's see, this guy right here. It dumps usually into the popliteal. That's that one. We do have great saphenous veins on a few of the cadavers, and small saphenous, I'm not sure if we do. Okay, and that is arterial flow and venous drainage of the lower limb.